Thank you, Acting Speaker. This is the 29th time that I'm speaking on the annual report of the Gauteng Health Department. You know, the depressing thing is that I looked at my speech from last year and nothing much has changed. I could repeat it with just a few small changes to the figures and, my previous speeches as well. Same thing is wrong in this department every year. The failures I pointed out are still there, and they've been there for many years now. We all know the dire need to fix our hospitals, but yet again there's a large underspend. Just wait for this figure, 2.6 billion rand compared to 1.1 billion rand the previous year. I mean, that's a huge amount of money, 2.6 billion rand. There's some departments that don't have those larger budget. All the departments' programs underspent. Despite crumbling and unsafe hospitals, the highest underspend was in health facilities management. 442 million rand wasn't spent, and believe it or not, 215 million rand of this is returned to Treasury, so we won't see it again. It was earmarked for occupational health and safety, which surely should be of prime importance to keep our hospitals safe for staff and patients. But what does this say about the competency in this department? The figure we're given is that out of 37 hospitals, 19, more than half, do not comply with basic occupational safety legislation. Now, every year there is a monstrous amount of accruals owing which has to be taken out of the current budget, and every year we are told that companies will be paid on time and the accruals will be cut down. The latest report is that only 41% of companies are paid within the legally required 30-day period, and the department is pleased with the progress because it used to be much lower. I've been hearing from a succession of premiers and health MECs how this department is going to be turned around. I've heard about task teams, I've heard about interventions, and I've heard about consultants. You would think that strong leadership was a priority to fix this department. But in the last 10 years, there have been 8 health MECs, 8 health MECs, which normally we change them nearly every year, and 9 heads of department. And there are still too many people acting in senior positions.